Imagine for a moment that your loved one, maybe your mom, your dad, your child, your sibling, or your spouse, is struggling with a serious mental health illness. The person that you care about deeply is going through a challenging and isolating experience. As their family members, you want nothing more than to understand what they are going through, to support them in any way you can, and as well to be an active part of their journey towards recovery and well being. But all too often, families find themselves to shut out of mental health treatment process. They face logistical barriers like inconvenient appointment times. They encounter perceptual barriers rooted in stigma about mental health illness. Other than that, they come up against cultural barriers within their communities, especially about discussing mental health openly. These barriers impede their ability to engage in treatment. The reality is that families are not just bystanders, especially when their loved one is dealing with a mental health challenge. It is imperative to involve families in the process of mental health treatment, especially for effective treatment and also for better outcomes. Family members often play vital support roles, such as providing practical help, emotional support, and influencing care seeking behavior. Involving families in this mental health treatment process also have significant benefits such as reducing hospitalizations, decrease symptom severity, and as well improve their family function and well-being. To promote family engagement, few strategies such as reminders, initial phone contact, face-to-face in-text, and family peer support must be used to overcome logistical barriers. For other barriers, mental health education must be provided in address to stigma about mental health, and cultural approaches must be adapted to consider norms within communities to improve engagement. Moreover, dedicated staff can be assigned for family outreach, and peer support from other families must be assigned to encourage engagement. Mayberry et al. In 2021 conducted a study using the Van Born Martins procedures among family members and carers of mentally ill families. They found out that family focused practices that include psychoeducation on diagnosis, treatment, and coping strategies, families as co-therapies in collaborative treatment planning, a coordinated system of care between families and services, practical, emotional, and social support for family members, and assessing family needs, and collaborative care planning can have a positive impact on mental health outcomes for both parties. In conclusion, actively engaging families through family focused, culturally responsive practices can improve patient and caregiver outcomes. As Helen Keller, a famous educator, once said, "Alone we can do so little, but together we can do so much." Thank you.